Temporomandibular joint. It is the articulation between movable mandible and fixed temporal bone. Basically, it is a gyngiomodiatroidal joint, which is a combination of sliding movement and hinge movement. Bony portions of the TMJ are articular eminence, glenoid fossa, and condyle. Articular surface of temporal bone consists of concave posterior part called articular fossa, and a convex anterior part called articular eminence. Articular fossa is an ovoid depression in the temporal bone, anterior to auditory canal. Condyle is the knob-like convex structure of mandible. Histology of articular surface consists of 4 layers: articular zone, proliferative zone, fibrocartilaginous zone, and calcified zone. Articular zone consists of collagenous fibrous tissue. Still, some elastin fibers are also present. Under this, cellular-rich proliferative zone present, which contains undifferentiated mesenchymal cells that give rise to fibroblasts, which later differentiate into chondroblasts. Beneath this fibrous layer, with cartilage-like cells are present, which is called as fibrocartilaginous zone. The 4th zone is calcified zone, which is rich in chondrocytes and chondroblasts. Articular capsule is the dense collagenous tissue that encloses the joint space. It is attached to the glenoid fossa and articular eminence superiorly, and below the neck of the condyle inferiorly. Articular capsule has an outer fibrous layer and an inner lining of synovial membrane. It has villi-like projections towards the joint cavity. This helps to secrete synovial fluids that aids in lubrication. Histologically, synovial membrane has an intimal layer that contains numerous synovial cells. Here, type A, macrophage-like cells, and type B, fibroblast-like cells are present. Subintimal layer composed of loose connective tissue containing blood vessels, fibroblasts and macrophages. Synovial membrane helps in lubrication by producing synovial fluid. It provides nutrients to avascular fibrous tissue. It controls the movement of electrolytes and nutrients to synovial fluid. It secretes proteins and hyaluronic acid to the fluid. Type B cells helps in the phagocytosis and debriding. Articular disc, or meniscus, is a biconcave pad of fibrous tissue, located between the condyle and articular surface of temporal bone. The disc is thinnest at the center, and thicker towards the periphery. Articular disc has 4 distinct regions: anterior band, intermediate zone, posterior band and bilaminar zone. The anterior region has 2 lamellae, upper one fuse with capsule and periosteum in the anterior slope of articular eminence, while the lower one fuse to the neck of the condyle. Posteriorly also the disc divided into 2 lamellae. Upper lamellae consist of fibrous and elastic tissue that fuse with the capsule, while the lower lamellae is non-elastic, that consist of only collagen, which blend with the neck of condyle. Between the lamellae, loose highly vascular connective tissue called as bilaminar zone. Articular disc divides the joint space into superior compartment, called temporodiscal, which is in between the temporal and disc, and inferior compartment, called condylodiscal, which is in between condyle and disc. 2 different compartments allows 2 different mandibular movement, that is, gliding movement in upper joint and rotational movement in lower joint. Since articular disc is a soft tissue component in between 2 hard tissue component, it prevents friction and reduce wearing. Its cushion effect helps in shock absorption. It stabilizes the condyle by filling the joint space between articular surface. Capsular ligaments are attached to the articular margins of the temporal bone superiorly, and to the neck of condyle inferiorly. Temporomandibular ligament or lateral ligament is a strong fan-shaped ligament, which helps to reinforce lateral wall of articular capsule, thus it limits the lateral and posterior movement of mandible. Superiorly, it is attached to the articular eminence and zygomatic process, inferiorly to the condyle and neck of the mandible. There are two accessory ligaments, sphenomandibular ligaments, and stylomandibular ligament. Sphenomandibular ligament extends from spine of sphenoid to the lingula and lower margin of mandibular foramen. It limits over movement of mandible. Stylomandibular ligament extends from lateral border of styloid process to posterior border of ramus of the mandible.